Hello, everyone. Welcome to the weekly COVID updates press conference. Today, we've got 4 speakers. We are going to start off with Craig Barnes with the Shawnee County Health Department, who's going to give us a quick update.
All right, thank you, Molly. I'm gonna, let's see here, start the video. All right, so I'm gonna go ahead and share my screen here real quick. Make sure I do this the right way again. All right, perfect. So you guys should be seeing in front of you now, this is the Shawnee County Health Department's webpage again. Just gonna use this to again show you that the dashboard can be found there pretty easily. Today, just our update is again, first just kind of show you the overall numbers, as well as show you guys the updates that we have put in place for this week that we kind of alluded to last week. So first off, I want to draw your attention to this. We have hit now our 100th confirmed positive case here in Shawnee County. So we have that as of updated as of today. The other 2 pieces I want to draw your attention to are our active cases. We have, as you can see from this line here, kind of started decreasing our current active cases. So those are the confirmed cases as we subtract the recoveries and the deaths. So we've had a good jump in the recoveries this week. And so as such, it has decreased our current active cases. And then the next one is here for the persons being monitored. We do currently have 114. And so remember those 2 numbers, I'll kind of allude to those here with my next update as well. But kind of going back to what we talked about last week, we have added these definitions to kind of really clearly show you what each of those numbers up there mean. The one specifically that we had been receiving some questions about in the public to hopefully kind of make that a little bit easier to understand what some of these numbers mean. And then the last update that we alluded to with the dashboard last week is we have now added this demographic section here. So these are, again, these are the confirmed cases that we have the confirmed positives. And then these are now broken down, as you can see, in a couple of categories. We are breaking them down by sex, by ethnicity, race, and then we do a bar chart down here for the confirmed cases by age to kind of hopefully make it a little bit more visible for individuals in our community as to kind of the demographic breakdown there. So that's all the updates for the dashboard today. Again, as last week, we tried to make it as easily accessible for everybody in the community to get to it. Our next update, I'm going to move to a different screen here. So what you should be seeing now is just a quick slide to talk about our COVID-19 investigation process. So what we wanted to talk about just briefly today is kind of the behind the scenes work of the disease investigators that are going on here in our community. So just to kind of helpfully bring some attention to this, when an investigation starts, that is really prompted when the state health department, KDHE, calls the health department to confirm a positive case. From there, those cases are then assigned to a disease investigator. So here at the health department, we actually have 25 staff and licensed volunteers that are doing disease investigation and are grouped into several different teams. So they are handling those active cases and those individuals who are being monitored. So those are the contact investigations. So what we really want to point out is it is necessary for individuals to answer their phone. So these contact investigators, disease investigators, are doing a lot of these investigations via phone. And we have to have access to individuals who are the confirmed cases and their contacts to start that investigation process. Because we are not able to consider somebody recovered and stop and close an investigation until they are 7 days past the onset of their symptoms and they've been 72 hours fever-free without the use of meds. So it's really important that the moment that you get a call from us that you do return it. We will leave voicemails with you if we're not able to touch base with you in person on that first call. But it is important that those calls are returned so we can start that investigation process. So those disease investigators will basically be checking in with those potential patients and confirmed cases on a daily basis to check with temperature and symptoms so that we can do a deeper dive into investigations or make sure that they are doing what they are supposed to be doing. And so again, I just end on that slide right there, that it is, again, just really important that individuals assist in that investigation by making sure that they do indeed answer their phone. So with that, that is all the updates from the health department today. So I will stop that and turn it back over to Molly. Thank you.
Thank you, Craig. Next up, we'll have Dusty Nichols give an update from emergency management.
Good afternoon, everyone. I am too going to share a screen real quick, and I'll talk a little bit about our press release today. First off, these are the resources delivered. These are the businesses and facilities we've been working with over the past couple of weeks. We've added about 6 new ones to our list. The items that are being delivered increases every week. You can see surgical masks, eye protection, so forth. We did add testing materials. We got a little bit of those in this week, and those were also dispersed. Molly will have these slides that you can send out. She can send out if needed. These are the other things that we've been working on. The mass fit testing, or excuse me, the mass fit for N95 is happening still with the 190th and our safety officer, Richard Siegel. We are seeing a shortage of gowns, and so we are actually looking for patterns and the correct materials. I think today they got that finalized. We'll be putting something up, so any of those crafters out there that are interested in making those gowns, we may have a need for those. We are just treading on that critical shortage for those. The Recovery Task Force is up and going, and they've broke out in their focus teams, and they're developing and rounding out those teams with partners that they believe might help those. Those are the areas. We do have, we had a really, really good cross section of everything going on at Topeka to include small business. And as you can see, government infrastructure, public safety is in there. All those things are in there. So I'm really excited about how that's starting to develop. I think they're going to come up with some good things. Now, onto the working document, which we just put out a little bit ago. We call this a working document because there's so many fluid items. As you know, you've been going through this. You've been going through this with us over the past 7 weeks that we've been really talking about it. You know that things fluctuate so quickly. You know that we were watching the numbers go up, and now we've leveled off. All these things that are happening. We do environmental studies, seeing what protection measures are being followed, what's being ignored, and just the general feel of the public. So as we implement each one of these phases, we need to use time frames, not timeline. The only timeline that's included in here is the base timeline of a 14-day incubation period. That's the only timeline that we could really use. Everything else is based on time frames. So it could be longer than 14 days. We got a lot of variables that we have to look at. Those tiers are based on those 14-day, at a minimum, day surveillance of patients, of the area, of the environmental studies. There's a lot of data going into that. Research and environmental studies specifically, they began this last week. Those are basically going to stores and just out in public. We have people with going out, looking out with the sheet and making notes and bringing that data back so we can see how well we are adapting to the current situation to hopefully kind of gauge what we're doing going forward. It can't not start. We can't do anything, as you know, as soon as the governor's order is in place. So when that expires, and I do know, again, another variable, that there's timeline differences between the declaration and our declaration and the stay-at-home order there. So we are right now looking at how that would become disjointed and trying to make sure that that's a seamless transition. And we got to balance the preparedness levels of our hospitals and our resources as we get back to normal. So it has to be a slow process. So if we see patients start to pop up or we get patients into our area, we have to be able to cover that with the resources we have at the same time trying to release. So it's a very delicate balancing act. I need everybody to understand this is not going to be fast. We have to look at each individual tier, all that environmental studies, all the resources we have, all the things that we have to really pay attention to before the next tier is implemented. And we got to anticipate that resurgence of this thing coming back again. And we know, we've heard in the national media and even locally that the fall time frame may be a time of resurgence. So I'll go ahead and let Dr. Pizzino kind of discuss a little bit more about that. And that's all I have for this week.
Thanks, Dusty. We'll now have Dr. Pizzino give an update from the health department and go into a little more detail on that plan. Dr. Pizzino, you're muted.
I just realized that. Sorry about that. Good afternoon, everyone. As you have heard from Dusty, we have been working, as we promised you last week, we will be doing on our plans to lift the restrictive measures, the community restrictive measures that we were forced to impose to contain and mitigate the effects of this pandemic. You have a copy of a high-level time frame that explains how this will work. So let me reiterate a couple of things here. First of all, we don't know when all of this will start. The earliest date right now would be May the 4th, but there is absolutely no guarantee that that's going to be the date that we can start this plan. The reason it's May the 4th is because the current order from the governor's office expires, the stay-at-home order expires on May the 3rd. What we will do at that point is examining a series of values and indicators and measures that we have been monitoring for a while. One, of course, is the number of cases. You have heard the bad news is that we hit number 100 now. It's just a psychological mark, if you will, but being in triple digit definitely doesn't make me happy. On the other hand, it doesn't really mean much. I mean, our cases have been increasing by 1, 2, or 3 units a day. Some days we have 0, some days we have 3 or 4. When you have such a reduced number of cases, it's hard to detect the real trends when you just look at the day-by-day changes. So one of the things we need to do is to look at changes over time and take some averages across, say, the previous 3 days or 4 days, and then see how those averages pan out and how smooth they are. But that's, of course, one of the first things we look at. How many cases do we have? The other important thing is, who are these people? Because there are people, I want to remind everybody, these are not cases, they're not numbers, they are real people. Who are they? Are these people that we know already, they are in our system because they were, for example, in contact with another person that we know was infected with coronavirus? Or are these people that have traveled to areas where we know coronavirus infection is prevalent? Or none of the above? These are just people that we have no idea where they got the infection, and it means they got it somewhere in the community. If we see a higher proportion of people in this last category where they got the infection but we don't know where, that would be reason for concern for us. That would mean that there is still a good deal of transmission of the virus in the community, and that we may not be ready to lift the measures that we want to lift in the way we want to lift them. But once all those conditions are met, and again, it will not be before May the 4th, but we hope it will be very soon after May the 4th, we will start lifting our restrictions a few at a time. As I've already said multiple times, this is going to be a trickle of water through a faucet, and we will open and close the faucet and let more water get through depending on what we see in our numbers. The first step will be to lift the stay-at-home order and allow people to go back to work, at least for the lucky ones who have a job, because we are very painfully aware of the fact that the current crisis has cost a lot of jobs in our community, and we know that, and we are sorry for that. So we will not keep people at home and away from their jobs 1 minute longer than we have to. So that would be the very first thing. And it may even be the only 2 items that we can include in the first phase, meaning you can leave your house. You don't need to have just an essential need to fulfill in order to leave your house, like the current situation. You can go back to work, and most businesses will be reopened. That would be probably it for the first 2 weeks. Most businesses will be able to reopen, not all of them. There are some businesses that, because of the nature of the business, because of the public traffic that may be inside the business, because of the contact between the customers and the business operators, some businesses have a higher risk of infection and transmission of coronavirus than others. So there will still be restrictions in the first phase more than in subsequent phases. There will still be restriction, and some business in the first 14 days may not be able to open at all. This phase will last a minimum of 14 days. The number is not arbitrary, as you probably know by now. That is the incubation, maximum incubation period of the virus. So what we want to see essentially is when we start opening this faucet, we have more water coming through, we have less social distancing happening. Are we going to see more virus being transmitted? And it takes up to 14 days to have a sense of whether that's happening or not. If that is not happening, if our numbers are still reasonably stable, then we will move into the following phase. And the following phase will include the ability for all businesses to reopen, also those that in the first 2-week interval were not allowed to reopen. Still some restrictions on some of those businesses. So they are open, but they may be subject to some restrictions, how many people they can allow into their premises, for example, and other things that we are studying. And an expansion on the number, on the size of social gatherings that will be allowed. So those are the 3 major things. And we will watch this for another 2 weeks. So you get the idea. We have in this plan, we have identified several phases here. Some phases will last more than 2 weeks. And the reason is that there are cases where we are planning to reopen certain activities that and to increase the size of the mass gatherings to a point where we really need to get that right. We don't want to take any risk that our action inadvertently causes a sharp increase in the number of cases in the community, and 14 days may not be enough for that. 14 days is the minimum. Now we may need to expand that to 28 days, and perhaps in some cases even longer than that. And in fact, I want to be clear, that applies also to the first 2 phases. When we say it's a minimum of 14 days, we mean a minimum. It is very possible at the end of 14 days, we say, we need 1 extra week. We need to monitor these numbers for 1 extra week before we can move into the following phase. In the best case scenario, which is the one that you have in the synopsis ahead of you, we have an earliest possible date where really most restrictions will be lifted of July 13. But a lot of good things will happen before July 13. As I said, it's going to be a phased-in approach. So it's not going to be all or nothing. We said since the beginning, we can't just turn the switch back on all at once. But by July 13, really, you should be able to recognize your lives as they were before. There will still be a few restrictions, particularly on, after July 13, particularly on large gatherings. When I say large, I mean several thousand people in that case. Before July 13, there will be restrictions for gatherings much smaller than that. And again, it will be a progressive process. The first phase, we may allow maybe just a few dozen people to get together. In the following phase, maybe a few hundred, and don't, the details again, they haven't been sorted out yet. But really what we want to do in the last phase is to just allow people to get back to their normal life as much as possible, but still keep an eye on the mass gatherings. And the reason is that if you think about it, if something goes wrong, when I say something goes wrong, I mean, you have somebody that doesn't know that they are infected with coronavirus and they attend the gathering and they infect other people. Right? Very possible. If the size of the gathering is just 20, 30, 40 people, that's bad, but we can take care of that. We know that our public health system, our healthcare system can take care of that kind of numbers. And they can provide the treatment necessary and the contact tracing investigation necessary. If the same case walks into a crowd of 3,000, 4,000 people, what is at stake is much higher. And so we really can't take that kind of risk. So we are going to be much more careful with large gatherings after even July 13 than we were before. A couple of other things that I want to stress and make clear. We will see an increase in cases. We fully expect that. So I will not get caught by surprise. I hope you will not be caught by surprise. Once we start lifting these measures, the number of infections will increase. It's very clear, social distancing works. It's just as simple as that. The virus does not jump from person to person. The virus is transmitted by direct contact. If we are not in contact with each other, there is no transmission. It's just pretty simple. The moment we start removing the social distance barrier, there will be more transmission. And that's okay, as long as the transmission is contained to a number of cases that we can manage. And as long as the people who have the highest risk of severe disease try to avoid the transmission as much as possible. So for the first, as long as, which is we can manage those cases, that means having a public health system who can respond to those cases, it can identify the contacts, it can test those cases and those contacts as necessary. We need to improve and increase our number of testing. We are doing very well in Shawnee County compared to other parts of the state, but we are nearly nowhere we should be if you really want to aggressively remove the social distance measures and move on to the following phases. And the second part of what I was saying is people at high risk of complications and deaths. As you know, those are everybody above the age of 65 and people with underlying conditions that can impair their immune system and their response to the virus. For the first several weeks, we are going to highly recommend, perhaps even require possibly, the people in those categories stay home. They just stay home. They should not take any risk because, again, we know there is going to be more virus around just because there is going to be more people around and people have the virus. Some people carry the virus. So that's the first thing that I want to be clear. There is going to be more cases, but we can't keep our community, our society, our state shut down forever. We fully realize that. So we will try to take some calculated risk. Ultimately, it comes down also to a personal risk assessment. People need to feel comfortable that what we tell them to do is safe enough to get out of their houses and do certain things. But if they don't, they shouldn't do it. The last thing I want to say in terms of what's ahead, this virus is here to stay. We shouldn't make any mistake or have any illusions. Just because we are seeing some decrease in the number of infections, both in Kansas and certainly Shawnee County and also elsewhere in the country, it doesn't mean that the virus has gone away. It will not. It's very possible this is going to be a seasonal virus. We don't know yet, but it's expected by everybody who's done this research, everybody in public health, everybody does modeling of these outbreaks. We totally fully expect the virus will be back a few months after the social distancing measures are relaxed. And that will take us just about the end of the summer, beginning of fall. What else happens during that time? It's the beginning of the influenza season. So we have to be very careful in monitoring the spread of the virus and make sure that we don't double up. Influenza season is already almost an expected crisis every year. And expected because we know it's going to happen, but crisis because nevertheless, even if we expect it, it is still overwhelming our healthcare system in many cases. All you have to do is ask any provider who works in urgent care during those months what life is like, or ask any ICU unit and of when is the busiest time during the year when they have so many patients that sometimes they even have to transfer patients elsewhere. That's the influenza season, right? putting a second virus on top of that is certainly not going to help. So if that happens, it's something, again, we need to watch very careful. And I've always tried to be very honest and transparent with the media and with our community. And I'm fully intending to do the same going forward. And for that reason, I'm going to tell you, there are reasons to celebrate. And hopefully in a few weeks, we can all get out of our house and carefully go back to our lives. But we also need to be flexible and be ready to come back into our house if we cannot contain the virus into its own box. Flexibility is going to be a key word here, both on the parts of public health authorities, but also on the part of the public. Don't get discouraged. Don't get despaired if at some point in July, in August, in September, whenever the need may be, we get back to our community and we say, it's not going well. We need to reimpose some of those restrictions. We don't like those restrictions and imposing them as much as you don't like them. But the alternative is worse. The alternative is to have hundreds of thousands of people sick, many dying. But even more important, if you will, if we are all concerned now about our economic recovery, as we should be, what kind of economy can thrive when people are sick by the hundreds or thousands and people are too afraid to leave their home because there is a nasty virus circulating in the community that we can catch just about anywhere, because 80% of the people who come sick, we don't know where they got it. There is no economic recovery without health recovery. And incidentally, the reverse is also true. There is no health recovery without economic recovery. So we are sensitive to both aspects of their recovery, as we should be. But I want to prepare everybody to the possibility that this document that we share today, we share that document in good faith. That's our best scenario pathway to going back to normal, but reality may be different. And reality may depend in part by what all of us do, by the extent to which we obey these orders, and some other factors that may be outside of our control. So flexibility is really going to be critical. Well, let me stop there. I presume that there are some questions for me or Dusty or anyone else, and we'll try to answer the best we can.
Dr. P, next we're going to go to Mayor De La Isla, and then we'll have questions after that.
Thank you.
Good afternoon, everybody. Thank you so much for joining us for yet another press conference. I want to start my message by telling everybody how much we appreciate all of your support. The fact that we are in a place in time that we are discussing our recovery is clearly indicative, not so much of your team, that is Dr. Pezzino, Dusty Nichols, and Linda Oakes, as well as the remaining team that works with us, but most importantly, this is a reflection of you as a community in Shawnee County and Topeka, deciding that you were going to take care of your neighbor and that you were going to do the best thing that you could do to keep everybody else safe. Because make no mistake, the fact that we are talking about a recovery today means that you were responsible and that you helped take care of everybody else, that you ensured that our hospitals were not completely filled, and that we were able to jointly ensure that we could have a quicker recovery. But like Dr. Pezzino said, I think that especially today, it's important for us to remember that this team is basing itself in a very emotional time on data and not on our emotions. So therefore, I want to make sure that I reiterate the message of Dr. Pezzino, that we are here for you, that we are very cognizant of the fact that we want to, and we will not, as a team, keep you home a day more than what you need to be home. But we're still going to be working together to keep everyone safe in our community, to ensure that this virus, as we are interacting back in what we may consider new normal with these parameters that are being presented in the plan, doesn't make us fall back into a situation in which we have a significant outbreak later on into our community. So to all of you, thank you who are at home. Now looking at May 3rd as a beacon of hope, and also looking at July 13th as a potential beacon of a lot of celebration in our community, in which we may be able to start interacting a little bit more normal than what we are right now. I want to say thank you, because this would have not been possible without all of you working with all of us. And most importantly, having trust that we were going to act on your behalf and in your best interest. To all of the medical personnel, thank you. To all of the CNAs, the grocery store attendants, the individuals that work in the pharmacies, all of the people that are working right now, to our first responders, thank you. Thank you for keeping our community safe. And let's make sure that we could just celebrate after July the fact that we have continued to be careful, and that we will be able to hopefully celebrate being able to just gather again a little bit more closer to what we would hope. So I will transition quickly into the Spanish portion of this. Queridos amigos, queremos dejarles saber que hoy hemos recibido noticias de que tenemos 100 casos de coronavirus. Lo bueno que le podemos decir es que de esos 100 casos, 80 son casos de personas que ya se han recuperado, y hay ahora mismo solamente 15 casos que son activos. 5 casos son las muertes que hemos reportado lamentablemente, pero al momento en la comunidad de nosotros solamente hay 15 casos activos. Les invitamos a que vayan a la página web de Shawnee County Health Department, porque ellos han añadido unas actividades demográficas que le dejan saber por edad cuáles son las personas que han sido impactadas, y no solamente eso, sino por etnicidad y por determinación de sexo, femenino o masculino, quiénes han sido las personas que se han enfermado. En adición, el señor Craig Barnes habló sobre los 4 pasos que se están tomando. Nosotros solamente empezamos una investigación cuando el Departamento de Salud del Estado de Kansas nos deja saber que hay un caso positivo en nuestro condado. Luego de eso, nosotros les llamamos por teléfono para recordarse que se quede en casa. El tercer paso es que nosotros entonces haríamos una búsqueda de con quién usted se puso en contacto para también comunicarnos con esas personas. Pero Craig les recordó que es muy importante que recojan el teléfono, porque cuando ustedes contestan su teléfono, quiere decir que están llamándoles para dejarles saber que ya están saludables o que tienen que estar todavía en casa. Así que por favor, cuando estén en este proceso, reciba la llamada. Es muy importante. Y finalmente le dejarán saber luego de 7 días sin tener síntomas o 72 horas sin tener una fiebre que no tiene que ver con medicamentos, que usted está ya claramente curado después de que tenga el virus. Luego de esto, el señor Dusty Nichols nos habló sobre todos los elementos que han enviado en la comunidad. Él también estaba diciendo que la base, la 190, que es el 190, donde están los coyotes aquí en Kansas, están haciendo lo que le llaman fit testing, que es tratando de ver cómo le caben las máscaras a las personas que las usan, porque hay una máscara que es muy específica y han estado trabajando muy fuerte en eso. En adición, nos han dejado saber que las batas necesarias disponibles para las personas que trabajan en los hospitales son necesarias y estamos cortos. Vamos a poner un guía de qué tipo de bata se puede hacer para que personas en la comunidad nos puedan ayudar con eso. También hablamos con el doctor Pezzino y con Dusty sobre el plan de recuperación de nuestra comunidad. Y es muy importante que todos entiendan que esto no es un paso a paso cronológico. Esto es más que nada ponernos a pensar sobre un proceso. Cada paso que tomemos, vamos a tomarnos 2 semanas para verificar si luego de haber implementado una técnica, una táctica, si no hay más casos. Si vemos que el crecimiento de los casos no es muy grande, vamos a la próxima. Y es como una manija del agua, ¿no? Cuando estamos abriendo el agua, cuando vemos que hay demasiada, la cerramos. Y así vamos a estar haciendo con este proceso. Es muy importante que todos cooperemos porque va a depender de nosotros ser responsables a que nosotros podamos seguir haciendo las cosas que nos hace falta. El doctor Pezzino también habló sobre que es muy importante que a partir del 3 de mayo, si la gobernadora no extiende su orden, entonces vamos a estar nosotros hablando de recuperación y de empezar a llevar a la gente nuevamente al trabajo. Es muy importante que eso va a ser lo primero que vamos a hacer porque entendemos que nuestra economía está sufriendo muchísimo. Así que lo primero que vamos a hacer es llevar a las personas a su trabajo. Luego de eso, 2 semanas, quizás 3 semanas después, vamos a empezar a evaluar a ver qué se va a empezar a abrir. Por ejemplo, restaurantes, iglesias, todas esas cosas que queremos tener más gente en ellas. Y cada vez que hagamos un paso, vamos a estar buscando 2 semanas a 3 semanas, quizás 4 semanas, para ver cómo están funcionando las cosas, porque si tenemos que parar y volver otra vez a ver cómo se está comunicando la enfermedad, vamos a parar. El día que tenemos pautado para tener más que nada aperturas en la comunidad es el 13 de julio. Esperamos que para el 13 de julio la gran mayoría de las cosas que estamos poniendo en pauta ahora mismo ya van a ser eliminadas. Por tanto, que podemos empezar a ver un poco más de la vida normal que estamos acostumbrados. Ahora, el doctor Pesino quiere que sepan que probablemente en septiembre o en octubre vamos a tener otra elevación del virus COVID. Y que es muy importante que entiendan que a la misma vez que esto pasa, es el tiempo que viene la influenza. Y son 2 virus muy poderosos que pueden estar uno contra el otro. Y eso sería muy triste porque sería muy denigrante para la salud de las personas. Así que tenemos que tener cuidado. Queremos que no se sorprendan si más o menos en septiembre o en agosto empezamos a ver el virus, porque estamos esperando, pero estamos viendo cada paso que tenemos que empezar a echar para atrás para que entonces no estemos verificando que los casos que tengamos sean suficientemente pequeños para que los hospitales puedan lidiar con ellos. Así que muchísimas gracias porque no podríamos estar hablando de la recuperación si no hubiese sido que ustedes trabajaran con nosotros y que confiaran que nosotros estamos operando para el bien de nuestro prójimo. Así que les quiero agradecer a todos por el sacrificio significante que han hecho, a cada uno de nuestros doctores, los enfermeros, las personas que los cuidan, a las personas que están en las tiendas donde ustedes hacen su compra, a todas las personas, los policías y los bomberos que están ahí apoyándonos cada día. Les agradecemos por ayudarnos a llegar aquí, porque esto no es crédito para nosotros, sino que el crédito es todo suyo. Muchísimas gracias.
Thank you, Mayor. Next, we'll hold the floor for questions. So just a reminder, say who you want to direct the question towards and then direct your question. You can raise your hand through the Zoom app. And first we'll have Sean Wheat and then we'll have Dan Garrett.
All right, Dr. Pizzino, this one is for you, sir. When it comes to, I'm actually going to go off of some of the questions that we received off of our Facebook Live. One person asked about, what about summer leagues and pools? Are we going to be able to see some of these things come back into place? And when you have an outdoor activity like that, if we're in that phase, how are you able to regulate? There's too many people here to there's not enough and you can continue on. I mean, how do we go about doing that in our new lives after COVID?
Sure. That's obviously a very good question. It's in many people's mind, and those are important activities that really define our summers. We are not in a position yet to discuss the details of what exactly we're going to do in each of those situations. What I can tell you is that we really hope very hard that sometime during the summer, all those things will be possible. Some of them may be possible just with some restrictions, again, maybe on the number of people that are allowed at one time to gather in a swimming pool or in a sports event. Others may be possible a little bit later in the summer than ordinarily they would start. Just do your math. We said that the earliest we can start this process is May the 4th. In the first 2 weeks, we will only lift the stay-at-home ban and let businesses reopen. There isn't much time left for some of those things to happen then by the end of May, for example. So it's still too early for the details. You will get more details sometime next week, hopefully. But my hope is that nobody will have to go through the summer without doing at least some of those activities that are the preferred activity for everybody in this community to do during the summer. It may just be a little bit more restricted in terms of size and in terms of time when they can do that.
This question is for Dr. Pizzino. How are the business leaders responding to these guidelines, and how much input did they have in making them?
Actually, I think I would defer the question to Dusty, if possible. I can add some thoughts later on, but I think he has probably the best information, either Dusty or Mayor de la Isla. They can probably answer this question better.
I can answer just a little bit of that. I think the mayor might have some more insight even. We started the recovery task force 4 weeks ago now, maybe even 5. Anyway, we started a while back, and we started bringing people online to discuss that. Some of those were business owners immediately, and of course those questions started coming up. When can we open? And we're basically telling them the same thing we're telling you guys right now, is there's so many variables. They have the orders in place. I think for the most part, we had some discussions with the USDs recently, actually yesterday, and then Greater Topeka Partnership and some others that, I mean, there's a level of disappointment that we can't get right back. Obviously, I'd be foolish to think that there wasn't, but I think the way this is being done, it's logical. It's we have to balance our lives with being preparedness, and more time ever before in this community probably than we have in the past. You can see at the national level a lot of criticism about being unprepared for this kind of thing. We're not going to do that if we could all avoid it. So I think that's understood by them, but I do think there's a level of disappointment. Mayor, if you got something to add, please do.
No, Dusty, I think that the sentiments that I'm getting is exactly what you said. But the beautiful thing of this plan is that we continue to work with our partners to make sure that we can continue refining and figuring out how we can keep working together. That's why we have a recovery task force, so that we can continue conversations. But Dusty's absolutely right. I think that there is a lot of desire for us to just get going, and we just want to make sure that we're doing that, but we get going in a safe fashion, in such a way that is safe for all. And I think that the one thing that we cannot underestimate is that if we don't do this right, as we look at our businesses and our economy, our biggest fear is that we are not going to have the trust of the employees to return to work. So we need to make sure that as we are working through this process, that we're doing it in such a gradual sense that people feel absolutely comfortable, the same way that we've been working with everybody to have trust, as we've been telling people to stay home. We want to make sure that everybody has trust, that as we say, here's the things that we're little by little moving towards, that people have trust and work with us to do that as well.
Next, we'll have Sean, followed by Dan again.
All right, thank you very much, Molly. Going back to Dr. Pizzino, we've talked about the peak a couple of times, and when we start seeing the fall, you've talked, and again, you've talked about this a little bit, but I kind of want to reiterate some of the information that you've talked about, was with the peak. I mean, even if in the next couple of days we start seeing those numbers trickle up, could you maybe even delay it past the May 3rd deadline, or the May 3rd lifting of the governor's order? And my second part of this question is, do you hope the governor basically lets the stay-at-home order on the statewide level go away so you guys can make the better decisions for the county?
Regarding the governor's order, I'm really in no position to have one preference or the other. What I do want for the governor, if I can express my want with the governor, is that she take care of the whole state and she keeps the whole state safe, because we are not an insulated community here. And frankly, when we were among the first communities who instituted some of these restrictive measures, soon we got concerned that communities around us were not. And you know, we know that people travel, come in, and you know, they commute, they travel for fun, for leisure. Unless we all have a minimum level of safety throughout the state, then nobody's safe. Essentially, we are just as safe as the weakest link of the chain being our entire state. So the governor will do what the governor needs to do, and we will be perfectly fine with that. I'm not going to second guess why the governor did certain things. If she lifts the order, I trust that she has good reason to do that. If she doesn't, I will wait until she's ready to do it. On the first question, we will be monitoring the numbers, as I said. And once again, May the 4th is the earliest date that we can start lifting the measure. There is absolutely no assurance that that is going to happen on May the 4th. We will monitor those numbers until really as close to our target date as we can. So don't expect big announcements, you know, Monday next week that affect activities for May the 3rd. It may even be May the 2nd or May the 1st before we can make that decision. Because again, I don't want to tell people, you know, you can do certain things, only then to have to retract that direction or that directive, you know, a couple of days later because our numbers are taking a different turn. So again, lots of flexibility. It may start on May the 1st, the 3rd. I hope it can. If not, it will start as soon as we possibly can. The same thing applies to the transitions to the following phases. You know, we hope that 2 weeks will be enough. If they're not, we'll make it 3 weeks. We will do everything we can to balance the safety of people with reopening our society to regular business.
So after looking at the guidelines, it doesn't look like an event like the Stampede could take place. So have you canceled that event? And if not, why are you waiting, or what are you waiting for?
Well, I tell you my part, and then Dusty probably should chime in there. We haven't really, I have it from my point of view. I just look at the public health aspect of these things. I haven't really considered individual events, and what you see in the guidelines is just, you know, the best guidelines we can put together based on the knowledge that's available and the best evidence that's available. I really can't tell you where a certain event falls, date, the size, etc. That was not my concern. So, you know, you can do your math. If you know the size of the Stampede and the date, and you look at our guidelines, you will see where the fits, and you can draw your own conclusions. But that's really not what was guiding us. And Dusty, do you have anything you want to add?
Sure. We started planning with the Stampede. Of course, we planned last year on that short notice event, but this year we started planning back in, I think, November for the Stampede this year. So as this started coming up, we put those plans aside and we haven't really dealt with them specifically. In the last couple of weeks, I have discussed what's been formulating over this past couple of weeks, building this working document. So this is probably kind of fairly new to them as far as these dates. So I haven't talked to them directly since this press release came out. So we'll be talking to them more than likely today or in the next couple of days. And it's their event. And I'm really focused on trying to get us through the next couple of weeks. That's mid-June. I know we are strategically looking out with these working documents and defining those, trying to define those mass gathering sizes and stuff like that. But what you just heard Dr. Pezzino say earlier, probably late July, before anything even close to that large would be allowed. Chances are they will make the decision on their own, and that's what we got to talk to them about. So.
Okay, we're going to have Sean followed by Dan yet again.
Sorry, I got on mute here. Going back to Dr. Pezzino, with the cluster sites here in Shawnee County, have we seen any decrease in the clusters or in the transmission at the cluster site here in Shawnee County, and have any more popped up?
No, we haven't seen any more clusters popping up. all the classes that we have in the county, I would consider them under control.
For Dr. Pizzino, I know you've talked about everything is fluctuating and it could change, but how likely do you think that these guidelines will stick to the dates that they're set at?
I'm not even going to try to put a number there. It would defeat everything I've been trying to say in the last 40 minutes. I would say there is a chance, otherwise we would not have put those dates there, right? We think it's a realistic option based on what we are observing right now. What we do not know is what we are going to observe tomorrow and the day after and the day after, every day that leads into those dates. So that's really the kind of uncertainty that we can't overcome at this point. So is it possible? Yeah, it is possible. Otherwise, we would not have included those dates there. Is it likely? I really can't answer the question.
All right, Sean Wheat is next.
Going on, another question here on social media from Paul was, when will population testing get started in Shawnee County, or is that even an option, Dr. Pizzino?
Oh, it is certainly an option. I think what your person was asking was referring to our blood tests that can be done to see if somebody has antibodies against the coronavirus, and that would indicate previous infection and possibly immunity. I like the idea a lot, so I would love to see that done in our county. We are not there yet. Those tests are just being released like in these last few days. I know that there are a couple of places already, in one even in Kansas, I believe in Johnson County, where they have been used. What I want to see is a little bit more validation of those tests, because there are some concerns that the accuracy of those tests may be unknown. Those tests were approved through an expedite process by the Food and Drug Administration in Washington. And, expedite process is good when you have a crisis situation, because you can get things through the system more quickly. But of course, most of the time, there is a reason you have a system, right? Because you have a lot of things to check to be sure that the product is released when it's mature and ready for release. I don't even know the availability of those tests right now, but I think at this stage in Shawnee County, it's probably going to be a little bit too soon. I want to wait until those tests are validated enough that when we get the test here in Shawnee County, we can rely on those results. I don't want to get too technical because it wouldn't be appropriate for this event, but anytime you apply a test like that in a place where you may have relatively low prevalence of a certain condition that you're trying to detect, the number of false positive and negatives may increase considerably. And so that may be the case in Shawnee County. We know we don't have a lot of coronavirus compared to some other situations. We are not New York City, obviously. So I just need to learn a little bit more about those tests before I feel comfortable in saying, yes, let's do a serious survey in Shawnee County. But once they're ready, I think they can provide very good information and very, very helpful information.
Sean has another question.
All right, thank you. And I guess this is more on the lighthearted side. Post COVID-19, and this is for anybody who wants to speak, is post COVID-19, post when we start getting these tiers in place and opening things back up. What's the one thing you're hoping, Dr. Pizzino, Dr. Mayor De La Isla, Molly, even and Dusty? What are some of the things you want to do again, or you're looking most forward to?
I need a hug.
You stole my thunder.
All of our thunder.
Hugging people, and certainly hugging my at that point probably newborn granddaughter. I'm sorry, she's expected to join the family sometime at the beginning of June.
I would say both of those things, but I really just want to go back to my sub basement and plan events in the dark in the background. That'd be nice, but being less facetious, I'd really like to get back in the theater and hang with my theater family and do another show, something like that.
Sean, I know you wanted my opinion on that too. I miss movies and sports. It's really weird not having sports on the TV and not having March Madness this year. That was wild. So would love to watch some baseball this summer, which probably won't happen, but
That's all I had. Thank you, guys.
Can I say something, since we have a couple more minutes? Can I add something, if that's okay?
sure.
Let me show the screen, and you may have seen that already, but you know, I've heard several times in the last few days. Can you see this chart, a chart on your screen with different color lines? Hopefully, yeah. I've heard several times in the last few days, you know, lines like, you know, all this sacrifice for what? I mean, they were talking about millions of deaths, and then now they brought it down, you know, maybe 60,000, and hospitals were ready with, you know, additional ventilators and ICU beds, and now they only have 2 or 3 people admitted. Why are we doing all this? I think there is a big misconception there. And I found this, I cannot take credit for this chart, but I think it's one of the best charts I've seen in a long time. So the red line here is the line if we do nothing, right? So that's over time is how many new cases you would have if you do nothing. And you can see the very familiar lines of those of us who have been following the spread of this infection for a long time. Sometimes you have these lines going up and up and up and going into what we call exponential growth. Number of cases double every few days. It's just horrible, and you just cannot contain it. That's where you have hospitals overwhelmed. That's where you have refrigerated trucks outside of the hospital to hold bodies and so on. But we are not following the red trajectory. We are following the green trajectory, because at the time that this started, right here, we started some efforts to contain the infection here in Shawnee County, as well in Kansas and most other parts of the country. As you can see, it takes time for those efforts to work. So at the beginning, it looks like nothing's really changing. And people may become a little discouraged. We are doing all of this and nothing changed. We're still having the same number of cases. In fact, they're going up. But then those efforts start working. Woo, look at this. Then the number of cases goes down, and then eventually goes totally down, it decreases. We are close to this stage. And what this stage also brings to us is usually see, it wasn't so bad, we overreacted. It is a huge misconception. The reason the estimates now are not for 2 or 3 or 4 million deaths, but maybe 60,000, I don't know what today's estimates are, is exactly because we are not on the red line. It's because we did everything that we did because our people went through the pain and suffering of staying home for weeks and weeks and staying away from their jobs, that we can now say we are on the green line. So really comparing those apples and those oranges makes absolutely no sense. It's misleading. And please help me spread this message. The 60,000 deaths are based on all the containment action that we've taken so far. They're not revised estimate because the first estimates were wrong. The first estimate was still not wrong. That's what would have happened if we hadn't done everything that we have done in the last few months. Thank you.
I don't see any other questions, so I want to thank you all for attending. And next week we will have another news conference, and it should be on Friday. So have a good Thursday, and we'll see you next week.